Now we will start with the 10th cranial nerve. So let us start drawing it. Now again, I'll take a couple of minutes to draw it. The thing that is easy here is that in the previous lecture of the 9th cranial nerve, what we just studied, the four nuclei, out of the four nuclei of the glossopharyngeal nerve, three of the nuclei are shared by the vagus nerve also. So it also has the same four functions. The same four functions. What were the functions? Can anyone tell me? Sorry. It will take a couple of minutes. Be a bit patient. We have to draw so that you do not forget it. The first nucleus was the general sensory nucleus, and the parts we already know. What were the parts? Principal, mesencephalic, and spinal tract part. So it's very good. We know it already. Remember, this nucleus also extends into the spinal cord. That's why it's known as the spinal tract nucleus. So the first function is general sensory. The name of the nuclei, mesencephalic. Then the second part is the large dilated part is the
principal part.
No, I just repeat in an attempt so that you people may remember it. Spinal tract part. Because the only thing by which you can remember something, it is repetitions and repetitions. The motor nucleus is the same. What was the color of the motor nucleus which we wrote in the last nerve? It was red. So
Red.
the next one is the motor nucleus. And what is its name? Can anyone of you tell me? Do you remember? It is nucleus.
Nucleus ambiguous.
Very good.
Solitarius.
Ambiguous. Nucleus ambiguous. Very good. Nucleus ambiguous, and we drew it in a red color. So let us draw it also. And it was, where was it placed? It was placed somewhere ventral in the medulla, like this. Huh? Now, the taste one, the third one, it was the tractus solitarius, which was located in the dorsal medulla. And now, yes, very good. I just heard someone whispering tractus solitarius. I guess it was from Essa. Yes, very good. It is like that. The third one is special sensory. And now the special sense which it carries is taste. It also carries taste. From the ventral, the dorsal most part of the tongue and the pharynx and the larynx, minor taste parts. So this is the tractus solitarius. So it is also known as solitary tract nucleus. Okay. And the different thing is, there is a nucleus which is present even behind the tractus solitarius. It is known as dorsal nucleus of vagus nerve. Let me pull this nucleus a bit forwards. And this one is the last one. It is the dorsal nucleus of the vagus nerve, which should obviously be what? Parasympathetic. So there is a nucleus on the ventral aspect of this also. And this is a parasympathetic nucleus. And its name is, repeat. Kindly repeat. The name is?
Dorsal vagus.
Dorsal nucleus of vagus. So that's very good. And it is parasympathetic. So the fourth function we write here, it is parasympathetic. So that's very easy. Now this nerve, the first thing, the most extensive supply of this nerve is parasympathetic. It goes to the last point of the mid cut. If you remember my lecture of autonomic nervous system. So first of all, we can draw it in any color. It is general sensory also, motor also, a wide distribution in the head and neck. I guess we could draw it in orange. It will be okay. The nerve emerges from the ventral medulla, lateral to the olives, inferior to, can anyone of you tell me? Inferior to what? The ninth nerve. Inferior to the ninth nerve, and it also gives two swellings like that nerve gave. Just a second. It also gives two swellings like the glossopharyngeal nerve. The name of the upper swelling is the jugular ganglion, and the name of the lower swelling is the nodosa ganglion. What is the name? Nodose, in fact, nodose, Nodose. The upper swelling is known as,
superior inferior नहीं कह सकते.
कह लें, कोई हर्ज नहीं. You can say. The first one is jugular. I'm telling you an extra thing which you, if you remember, it will be good for you. The upper one is jugular ganglion and the lower one is nodose ganglion. Here, somewhere here we have the jugular foramen. So, what is the name? The upper one, it is jugular ganglion, and the lower one is nodose ganglion. And what is the name of this opening? Please tell me.
Jugular foramen.
Now at least you remember few things. I hope many. But at least few. Now we'll now start drawing the branches. The first branch, which is all usually what we can say, which is forgotten. The two branches. At this level of this ganglion, two blue branches emerge. One is the meningeal branch and one is the auricular branch. What is the first one? This is the meningeal. And obviously it will be general sensory to the meninges. And this is what? The auricular. And where should it go? Auricular to the air. Auricle, external air. So it is going to the external air, obviously, and it is taking general sensations from the outside of the tympanic membrane, which we just discussed from the tympanic plexus. Got it? Now, as we go down at the level of the nodose ganglion or the inferior ganglion, this nerve gives a large plexus, which is both made up of red fibers as well as blue fibers. And this network is known as the pharyngeal plexus. What is it known as? What is it known as? Please repeat. The pharyngeal plexus. Now look, we had a pharyngeal plexus in the 9th nerve also. And now we have a pharyngeal plexus in the 10th nerve also. So this is the pharyngeal plexus, which is majorly motor and partly general sensory. Now we should write it here separately. The pharyngeal plexus of the vagus nerve. Now it is very, very, very important. Now just look what am I writing. Number 1 point, it is very important. It supplies, it is motor, so it will be supplying the muscles, all muscles of the pharynx except, can anyone tell me?
Stylopharyngeal.
Very good, very, very good. Except, we will highlight it like being a bold capital letter, except stylopharyngeus, which was supplied by what? Which was supplied by the glossopharyngeal nerve, the 9th cranial nerve. So got it? Now the second point, which is again very important, it supplies all muscles of what? Of the Shabash, tell me.
Soft palate.
Excellent. Soft palate, Natasha. Except.
Tensor villi palatini.
Very, very good. Except tensor.
Tensor villi palatini.
Very good. Tensor villi palatini muscle, which was supplied by?
It is supplied by mandibular nerve.
Very good. The nerve to medial pterygoid, which was a branch from the main trunk of the third division of the trigeminal nerve. So we can write the 5th cranial nerve, third division, which was mandibular division obviously, and main trunk. And the branch was nerve to medial pterygoid, which not only supplied the medial pterygoid muscle, but also the tensor villi palatini muscle. So, got it? Are you clear? Okay. Now, the pharyngeal plexus is partly sensory also. So, it will be giving some sensory supply. So, the third point, we should write it in a blue color. it carries general sensory sensations from the, repeat,
सर किसका बता रहे हैं?
laryngopharynx, ये वही है, from the laryngopharynx. Now, this pharyngeal plexus also has some green colored fibers. It also has some green colored fibers. We will draw it afterwards. First I may write it, that it also carries taste from the posterior most tongue and from the posterior most tongue there are minor taste buds. If you eat something bitter, you can feel sometimes the bitter taste in the back of the nose, in the throat, in the pharynx. So in the tongue, in the posterior most of the tongue, the pharynx, and even the epiglottis also. इस area की जो taste है वो ये carry करता है. Now there is a very big reason which I can just guess or conclude, that why does this nerve carry taste and is motor also? Now look, most of the bitter taste are sensed on the posterior most part of the tongue. Whenever you taste a bitter taste, you feel it in the root of the tongue or the posterior aspect of the pharynx. As most poisons are usually bitter in taste, that's why the creator of humans made this nerve carry taste from the posterior most part of the tongue, so that if someone by accident consumes some sort of a poison, this nerve gets irritated and this nerve will result in irritation of the pharyngeal muscles, and there will be a gag reflex, so that that odd tasted poisonous thing may be removed or ejected out from the body. Did you get my point?
Yes, sir.
Okay, that's very good. Now, as this nerve moves, it gives two very important branches more, and that is, can anyone tell me? The superior laryngeal nerve. What is this nerve? This is the superior laryngeal nerve, and I will just mark a stamp here, and we will continue this nerve here, somewhere here. We will draw it here, so that we may not get a scattered sort of a complex figure. So this nerve is known as the, please tell me, what is the name? This is the
Superior laryngeal nerve.
very,
laryngeal.
very good, superior laryngeal nerve. What should be the color of this nerve? Anyone? Tell me. The color of this nerve should be blue as well as red, so we could make it like that. Why? Because this nerve is not only general sensory, but it is also motor. Excellent. This nerve divides into two branches. Tell, you people are very good. You are excellent, amazing people. The upper branch is known as
External laryngeal.
internal. Sorry.
Internal and external.
Internal laryngeal was the general sensory nerve, and it carried sensations from the larynx above the vocal cords. Above the vocal cords. This is its function. Okay, there's a bit overstepping. Now, and the second nerve, what is its name? This is external laryngeal nerve, which is motor, and it is motor to cricothyroid muscle. Did you get it? I guess there is no confusion. And the important point about this nerve is, the most important point about this nerve was what? This point. We should write it here. It can be damaged in a thyroid surgery, surgery while ligation of what? Tell me. While ligation of the superior thyroid artery. Very good. Superior thyroid artery. And if this nerve is damaged, what will happen? If damaged, it will result in
Husky voice.
husky voice. And one more thing, the artery should be ligated near the gland to prevent this damage. Done? So it's very simple. Now the other branch. Let us go back to that figure which we were drawing, and then as this nerve moves down in the carotid sheath, there is one important thing also. We should write it here. It descends in the what? In the carotid sheath behind in the groove between the internal jugular vein and the common carotid oblique internal carotid, because below the level of bifurcation it will be common carotid, and above the level of bifurcation it will be the internal carotid artery. Okay? Now as this nerve is moving down, just at this point it gives another branch which we should also draw in a dual color, which is blue and red, and the name of this branch is, oh sorry, just a second, we did not change the color. The name of the color of this nerve should also be blue and red, and we again mark a stamp here that this point, you can say here that this point is continued like this, and this nerve moves down into the thorax, and this is known as the recurrent laryngeal nerve, and it loops back upwards. It loops back upwards. The name of this nerve is recurrent laryngeal nerve. We should change the color into blue, and again, what should I do? I should make a box around this nerve in a red color so that we designate it not only as a general sensory nerve but also a motor nerve. The right-sided nerve, can anyone tell me where does the right-sided nerve loops back, from which point? Okay, the left one loops around please tell, the arch of aorta, and the right one, anyone? You do not know it? That's bad. The right one loops around the brachiocephalic trunk, and it comes back. It moves down, it loops around and comes back. Let me show you a figure here. Just let me show you a figure here. If we just see, it was somewhere like plate number 80 or 90. Yes, this one. No, yeah. Now we are seeing it from the back side. This is the left-sided nerve, the recurrent laryngeal. It goes down, loops around the arch of aorta and comes back up. This one is the right-sided one, because we are seeing from the behind. We are sitting inside the pharynx, and from the behind of the patient we are seeing inside. This is the right one. Look, this is the right recurrent laryngeal nerve, and it is looping around the brachiocephalic trunk, or the subclavian artery also you can say, and they move upwards back. Clear?
Yes, sir.
Now, what does this nerve do? Number one, it carries general sensory functions as well as motor functions. Number one, it is general sensory it is general sensory to the larynx, inside of the larynx, obviously to the larynx, below the level of below the vocal cords or the vocal folds. And number 2, it should be written in a red color because it is motor. It is motor to all muscles, intrinsic because the larynx has extrinsic muscles also, जैसे thyroid, sternothyroid, stylopharyngeus, palatopharyngeus. Intrinsic muscles of larynx except
Cricothyroid.
very cricothyroid, which is supplied by the external laryngeal nerve. So, is it easy? I guess it is very, very easy. So this nerve, obviously we can show that it is not only blue, but it is also red in color. It supplies both functions. So if you try to make it, it will make a bit mess, but you can show it in.
सर ब्रेकियोसेफेलिक ट्रंक क्या था वो जो एक्सिलरी आर्टरी के ऊपर
Leave it. If you have forgotten it, then leave it.
सर बताएं
Brachiocephalic trunk was the first branch of the arch of aorta, which divided into the right subclavian and the right common carotid artery. Because the left common carotid and the left subclavian artery is a direct branch from the arch of aorta. The right-sided one originated from the brachiocephalic trunk. Now, is it simple?
हाँ जी सर
Now, what will happen
यस
next?
सर
Next, the thing which is happening next is very important. But as we are studying the head and neck at the moment, this point will go into the thorax. But before that, let me tell you the clinicals of recurrent laryngeal nerve. The clinicals of recurrent laryngeal nerve. This point. The recurrent laryngeal nerve again, it can be damaged. Can be damaged in what? In a thyroid surgery, thyroidectomy, and while ligation of what? While ligation of the
inferior thyroid artery
very good inferior thyroid artery, and we have already discussed these things in the detail when we were studying the arteries, so I'm not going into much detail. And as this nerve and artery is close to each other near the gland, so this artery should be ligated away from the gland. This artery should be ligated away from the gland or as low as possible away from the gland. And if it gets damaged, अच्छा इसमें एक और बात है, there is one again more important thing. Which sided recurrent laryngeal nerve is most commonly damaged, right or left? This is an important point.
maybe right
Left is more commonly damaged. I will show you, I'll tell you. Because it is near to the gland. Left is more commonly damaged. Let me show you just here. Come here. Now look. Can you see that this right-sided nerve is near the artery? Sorry, right. Obviously, sorry, right. The right one is near the artery. The left one is away from the artery. Sorry, just did it in a hurry. It is the right. Sorry. This one.
सर राइट इसलिए क्योंकि ये डायरेक्ट ब्रांच है
नहीं, ब्रांचेस तो सारी डायरेक्ट हैं. ब्रांचेस तो सारी डायरेक्ट हैं, वो करीब पड़ी हुई है ना आर्टरी के. सॉरी, दिस वन इज राइट. सॉरी. And if it is damaged, what will happen?
So hoarseness of voice.
Hoarseness of voice.
Unilateral damage, the damage is hoarseness, low pitched voice. And if bilateral damage, which cannot be usually during a surgery, if bilateral, choking. Yeah, the vocal folds, the vocal cords will acquire cadaveric position, and airway has to be maintained, otherwise the patient may choke and die. And the airway has to be maintained, otherwise the patient can die because of choking. So these are the clinicals of these nerves. Now we can stop here for 1 minute. Just ask me any question which you are confused about. Which you are confused
सर
about.
आपने बात की कि डिसेंड्स इन द कैरोटिड शीट, ये जो वेगस नर्व है वो डिसेंड करती है या इसका जो पैरासिम्पैथेटिक पार्ट है वो डिसेंड करता है?
We are drawing the vagus nerve in the orange color. I just made it in orange because the major delivery is parasympathetic delivery, which we have not studied up till now even. The major part of the nerve is parasympathetic. That's why we made it in an orange color. However, the nerve descends as a whole. ठीक है?
ओके सर.
सर ये राइट और लेफ्ट रिकरेंट laryngeal
Obviously,
की
right and left.
ब्रांचेस हैं जो लूप करेगी.
Yes. The recurrent laryngeal
Okay,
nerve
sir.
is looping back. So now, this nerve descends in the thorax on the either side of the esophagus. In the thorax, it enters and is present on the right and left side of the esophagus. What will it do? What will it do? I have to write it. We will write it. Descends the thorax on either side of the esophagus. We are not studying the thorax at the moment. I have to tell it is in the superior mediastinum or the posterior mediastinum. We can go it in the detail, but at the moment I'm not, because I will skip the nerve otherwise. The remaining I will tell in the thoracic portion and the abdominal portion. Descends in the thorax on the either side of the esophagus. It supplies, number one, it supplies parasympathetic supply. It gives parasympathetic supply too. Can any one of you tell me? Number one, the heart through. There should be a ganglion, as it's a parasympathetic nerve, through the cardiac plexus. Which plexus? The cardiac plexus. The nerve before the cardiac plexus is preganglionic, and the nerve after the cardiac plexus is postganglionic. Will you remember it? And the lungs and the thoracic respiratory system, the respiratory passages through any one of you, do you know it? Through the pulmonary plexus. Through the pulmonary plexus, which is again what? A ganglia. The nerve before the pulmonary plexus is preganglionic, and after the nerve is the postganglionic one. Okay. And number 3, the foregut and the midgut. Through the ganglia, what are the ganglia of the foregut and midgut? Through the Meissner's. What was the other name of Meissner's? Submucosal and Myenteric. What was the name? Orbach's. Plexus, which are parasympathetic ganglia of the foregut and the midgut in the GIT. Now, what is foregut and what is midgut? Let me tell you in a bit detail. The foregut, we can write it in another color. Does anyone of you know it? What is the foregut? Oh, sorry. Just a second. It may take a couple of seconds. Now, what is the foregut? Ji. Foregut is esophagus, stomach, first part of duodenum, and first half, your proximal half of second part of the duodenum. This is the foregut. Okay. And does any one of you know what is the midgut? Does any one of you know what is the midgut? It's very easy. No. No one knows? Okay. You want me to do all of the things, huh? So we will tell you what is the midgut. Starting from the point which we left, the second half of second part of duodenum, third and fourth part of duodenum. What is the next part of the gut? Jejunum, then the ileum, then the cecum with the appendix, ascending colon, and proximal, your first 2/3 of the transverse colon. So this is the midgut. The remaining part of the GIT is known as the hindgut, which is supplied by pelvic splanchnic nerves having a root value of S2, S3, and S4, and which come from the spinal cord. Now, are you sure? Are you clear? And one thing more. There is a very important point which definitely I will be repeating again in my thorax and abdominal lectures, but I should like to write it. I want to write it, in fact, that when this nerve crosses the thorax and enters the GIT and enters the abdominal cavity, it passes through the esophageal opening. Which opening? There are 3 large openings and multiple small, 5 to 6 multiple small openings in the diaphragm. The 3 larger one, do you remember the aortic opening, the caval opening, and the esophageal opening? Do you remember it? So much silence. So there is another thing which you should write it here. The nerve passes from the thorax into the abdominal cavity, into the abdominal cavity through the esophageal opening. And what is the level of that opening, by the way? Yes. Any one of you, can you tell me? Are you alive even? Kidhar ho? Can any one of you tell me the
सर
level?
नहीं पता.
No. At the level of 10th thoracic vertebra. I will tell you, do not be worried. I'll teach you all, inshallah, and you will know it very effectively at the level of 10th thoracic vertebra. Okay. I guess it is sufficient in the vagus nerve. So you can take a screenshot, you can save the image. I've recorded the lecture as well. I will be putting it on the channel. So any question, I'll stop recording. 25 beautiful people. Any question up till now? Are you so much clear? So I taught you so well, huh? Okay, the young lady. So you are asking the supply of the hindgut, the parasympathetic supply of the hindgut. It is through pelvic splanchnic nerve, which has a root value of S2, S3, and S4, which comes directly from the spinal cord. So this vagus nerve is known as vagus because vagus is derived from vaga. Vaga means avara, someone which roams around, because it's a cranial nerve and it is supplying somewhere in the transverse colon. So it's very ambiguous sort of a thing. It's very ajeeb si baat hai.